In '83 there was, quite specifically, I recall listening to a broadcast about this new mysterious disease that had turned up in New York. It was called GRID, Gay-Related Immune Deficiency Syndrome. There wasn't a lot of information. We had no medical knowledge. You know, if you'd asked me what a virus was, I couldn't have told you.
HIV-AIDS was known to me before I went into this portfolio. The actual severity was brought to my attention by the department, who were now part of the national HIV-AIDS campaign.
A year later, it became much more prominent when the first AIDS death was recorded in Queensland, and then the death of the 3 babies from the Mater Hospital. It ended up being 4, but one died a little bit later on. In the earliest days, nobody knew who was infected and who wasn't, because there was no test until about April '85, I think.
You can't cure it. You can manage it now, but at that time it was a death sentence.
Well, it was very frightening. People did commit suicide when eventually they were diagnosed, but people in the earliest days, people got sick and died very quickly. Most people died of pneumocystis carinii pneumonia, which is a pneumonia that you'd normally only find in women who'd just given birth, where their immune system's lowered and what have you. They'd just lose weight, become very ill, and pass away in a matter of weeks, perhaps, from when the symptoms. They may well have been infected for some years before, but didn't know.
Wherever I went, I would say to people, and I would have addressed at least 100 meetings, there was fear. There was fear there, and they were saying, well, what can we do? People were thinking that it only affected male homosexual people, and it's not true. Organisations
And health departments, for that matter, were still talking about mosquitoes not being a vector. You know, there are poofters in my street. Should I get fly screens installed? You can only laugh at it now, but it was dangerous and it was frustrating back then.